Are you aware that colon cancer is the third most common cancer worldwide? Shockingly, it's estimated that nearly 1.5 million people will be diagnosed with this condition this year alone. But here's the thing, early detection can save lives. That's why today, we're diving into 8 critical colon cancer symptoms you should never ignore. From subtle changes in bowel habits to unexplained weight loss, these signs could be your body's way of warning you about a potential health concern. So buckle up and join us as we explore these symptoms in detail, empowering you to take charge of your health and well-being. Let's get started. Starting with number 8, persistent changes in bowel habits. Persistent changes in bowel habits warrant careful attention, particularly alterations such as diarrhea, constipation, or variations in stool consistency that endure for more than a few days. These changes can signify underlying health issues ranging from dietary concerns to more serious conditions such as inflammatory bowel disease or gastrointestinal infections. Monitoring and promptly addressing such changes is crucial for maintaining overall well-being and identifying potential health concerns early on. Before we continue to the next symptom on our list, make sure to like this video and subscribe to the channel so you can get more health-related information through our videos. Bringing us to number 7, blood in stool. The presence of blood in stool can manifest in varying forms, ranging from bright red blood to darker, tarry stools. Regardless of the hue, any indication of blood in the stool warrants immediate attention and evaluation by a healthcare professional. Bright red blood in the stool often suggests bleeding from lower in the digestive tract, such as the rectum or anus, while darker, tarry stools may indicate bleeding higher up in the gastrointestinal tract. These symptoms could stem from a multitude of causes, including but not limited to hemorrhoids, anal fissures, inflammatory bowel disease, gastrointestinal ulcers, or even colorectal cancer. Prompt evaluation is crucial not only for diagnosing the underlying condition, but also for initiating timely treatment to address potential serious health concerns. Therefore, seeking medical assessment upon noticing blood in the stool is essential for proper diagnosis and management. Number 6, we have abdominal discomfort. Persistent abdominal discomfort encompasses a range of sensations, including cramps, gas, pain, or a feeling of fullness, and should not be disregarded, particularly when accompanied by other symptoms. These sensations could signify underlying health issues affecting various organs within the abdominal cavity, such as the stomach, intestines, liver, gallbladder, pancreas, or kidneys. While occasional discomfort may result from benign causes like indigestion or mild gastrointestinal upset, persistent or worsening symptoms may indicate more serious conditions such as gastritis, irritable bowel syndrome, gallstones, pancreatitis, or even abdominal malignancies. Let's move on to number 5, unexplained weight loss. Characterized by a reduction in body weight without intentional changes in diet or physical activity, can serve as a significant indicator of an underlying health issue. This unintentional weight loss may signal various conditions, ranging from benign to potentially serious, including but not limited to gastrointestinal disorders, endocrine disorders, infectious diseases, and malignancies such as colon cancer. While occasional fluctuations in weight are normal, persistent and unexplained weight loss, especially when significant, should prompt consultation with a healthcare professional. Rapid or substantial weight loss without apparent cause warrants timely medical evaluation to identify and address any potential underlying health concerns. Number 4 on our list is fatigue. Constant fatigue or weakness, particularly when severe or persistent, can serve as a significant indication of an underlying health issue, potentially including colon cancer among other conditions. Fatigue is a common symptom that can result from various factors, including lifestyle, sleep disturbances, stress, or certain medical conditions. However, when fatigue is constant, severe, or unrelenting despite adequate rest and lifestyle adjustments, it may signal an underlying health problem that warrants medical attention. In the context of colon cancer, persistent fatigue could be attributed to factors such as anemia, resulting from chronic blood loss in the gastrointestinal tract, or the body's immune response to cancer cells. Therefore, individuals experiencing persistent or severe fatigue should consult a healthcare professional for a thorough evaluation to identify any potential underlying health issues, including but not limited to colon cancer, and to initiate appropriate management. Bringing us to number 3, iron deficiency anemia. Iron deficiency anemia is a condition characterized by a decrease in the body's red blood cell count or hemoglobin levels due to insufficient iron. One of the potential causes of iron deficiency anemia is slow and chronic blood loss in the digestive tract, which can be indicative of underlying gastrointestinal issues, including colon cancer. When blood loss occurs over an extended period within the digestive tract, such as the colon or rectum, it can lead to depletion of iron stores in the body and subsequent development of anemia. Shortness of breath can occur due to the body's increased effort to compensate for the decreased oxygen supply to tissues. Let's move on to number 2. Persistent cramping or gas. While occasional gas and stomach cramps are common and often benign, persistent or chronic cramping, gas, or pain in the abdominal region could signal an underlying health concern, including the potential for colon cancer. These symptoms may persist over time and be accompanied by other gastrointestinal disturbances, such as changes in bowel habits, rectal bleeding, unexplained weight loss, or fatigue. While not necessarily indicative of colon cancer on its own, persistent cramping or gas warrants medical evaluation to identify the underlying cause and determine appropriate management. Colon cancer is one of the conditions that can present with persistent abdominal discomfort, including cramping or gas, due to the tumor's impact on the digestive tract's normal functioning. Number 1, we have feeling of incomplete emptying. The sensation of incomplete emptying after a bowel movement, where one frequently feels the need to pass stool but doesn't experience relief afterward, or feels like the bowel doesn't empty completely, can potentially be a sign of colon cancer. This feeling may persist despite multiple attempts to pass stool and can be indicative of an obstruction or blockage within the colon caused by a tumor. Colon cancer can obstruct the normal passage of stool through the colon, leading to symptoms such as a persistent feeling of incomplete emptying, changes in bowel habits, abdominal discomfort, or bloating. While not all cases of incomplete emptying are due to colon cancer, this symptom, especially when accompanied by other concerning signs such as rectal bleeding, unexplained weight loss, or abdominal pain, warrants prompt evaluation by a healthcare professional. Thank you for watching our video on the 8 critical colon cancer symptoms you should never ignore. Remember, early detection is key in fighting colon cancer, so if you experience any of these symptoms, don't hesitate to reach out to your healthcare provider for further evaluation and guidance. If you enjoyed this video and found it helpful, don't forget to give it a thumbs up, subscribe to our channel, and hit that notification bell so you never miss our future content. Together, let's spread awareness and empower each other to prioritize our health. Stay informed, stay proactive, and take care of yourselves. Thank you again for watching, and we'll see you in the next video.